After 5, 10, 15 years of doing the same thing and you're really not any better and you're still having major panic attacks and you're still incapable or unable to leave your home or your room because of the traumas that you relive in your mind 24/7, something has to give.
Welcome to The Healing Blueprint. I'm your host, Jill Briansky. On this podcast, I speak with experts from traditional and holistic healing modalities. And together, we share insights, tools, and practical guidance so you can create your own healing blueprint. Let's move into today's episode and get started. We are joined today by Dr. Joseph Rosado. Welcome to the show, Joseph.
Thank you, Jill. It's a pleasure being here today. How have you been since the last time we communicated virtually?
I've been great, thank you. And I appreciate you being here with us today.
I appreciate the invitation.
Can you give our audience an idea of who you are and your vast background in the medical community?
Absolutely. So I am the atypical medical doctor. I started my medical career at the ripe young age of 16. In 1978, when you could be a certified nurse's aide at the age of 16. I did the CNA orderly training in my sophomore year in high school, and the requirement at that time was to pass the course, pass the final exam, and be 16 years of age. Well, I did all three. And so when I turned 16 on June 24th, in fact, 6 days from today, from the recording of this show, once I turned 16, I started working as a certified nurse's aide. Then I paid my way through high school, the last 2 years of my high school, became an EMT, became an EMT paramedic, then became a cath lab technician. Then I went to chiropractic school. Then after practicing chiropractic for 5 years and being frustrated with the limited scope of practice, I opted to go to medical school. And then about a year or two after graduating medical school, I went out and got an MBA in healthcare management. So that's my academic training. As far as practices, I've done multiple things within healthcare, but usually and always in and around the underserved, underrepresented communities. From being a communicable disease director for a county health department to being a clinic lab director for a community mental health facility, working in urgent care, primary cares in urban and rural areas, as well as being medical director for hospitals in rural areas, working in departments of corrections, both jails and prisons, and then moving on doing bioidentical hormone replacement therapy. And from 2016 to present, that was the first in the greater Central Florida area to recommend medical cannabis to a 35-year-old female who had a stage 3 brain tumor. And then 3 months after that, I was the first in the state of Florida to recommend medical cannabis to a 15-year-old boy who had a stage 4 head and neck tumor. And then since 2020, I've been utilizing ketamine-assisted psychotherapy for the management and treatment of patients with treatment-resistant depression, suicidal ideation, post-traumatic stress disorder, and traumatic brain injuries.
You have certainly made your way around the entire medical community in many different respects. And I'm wondering what it is about medicine or this field that got you started at such a young age and have kept you going.
At the age of 4, I knew I wanted to be a physician because of a very positive experience I had with a pediatrician. The initial visit with him was completely different from any other medical office visit I had experienced. And as a result of that experience, I knew I wanted to be a physician. I thought I wanted to be a pediatrician like him until I realized that kids are phenomenal, parents not so much. And so I decided against doing pediatrics. But lo and behold, there's a saying in Spanish that for the person that does not like soup, they give them 2 cupfuls of soup. And so I didn't like pediatrics, again, not because of the children, but because of the extended family. But because I was the first in the state of Florida to recommend medical cannabis to a child, it opened up the floodgates literally to manage other children that were having intractable seizures or special needs in some way, shape, or form. And so I am one of a few physicians in the state of Florida that recommends medical cannabis to pediatric patients, but also I have a practice in the state of Michigan where I am also licensed that is exclusively a pediatric practice. So there you have it. I kind of did eventually become a pediatrician.
You came full circle. So let's talk about the medical cannabis. What does that do? So you mentioned two different people, one having cancer, one having a tumor. What does that do for them?
Well, medical cannabis is one of those noble plants that, depending on what the situation is or the ailment, the substances found in the plant will find their way to the different receptors in the body and do what needs to be done. So in the case of patients with cancer, it helps with the nausea, it helps with the vomiting that is related and associated with many of the treatments used to manage and treat the cancer. It stimulates appetite for individuals that have undergone certain treatments and have no appetite. It supports in maintaining their weight or causing weight gain. It also helps with the anxiety and the depression that's related to being diagnosed with a chronically debilitating condition. Many people are still of the belief that once they hear the C word, it's almost as if it's a death sentence. And things have moved and evolved in so many areas that it's not always going to be that way. Also, together with that, also sleep. A lot of people that have been diagnosed with cancer have a very difficult time sleeping. And so it helps them with their ability to sleep and their pain. If the tumors are in a region or in an area that have caused some type of pain or discomfort, it helps alleviate some of the pain. So it's a multifaceted plant treatment, and it helps multiple things, not just one specific thing.
And you're specifying medical cannabis.
Correct.
Why are you making that specification?
Because if it's not medical cannabis, it's adult use cannabis, which is a state or a jurisdiction that you don't need a physician to be the gatekeeper. You can walk into a dispensary and purchase whatever it is you want. There are certain states that have that designation. Florida is not one of them. Michigan is. And because in Michigan, it is that way. That's why I cater my practice strictly and solely to pediatric cases, because a child cannot walk into an adult use dispensary. You have to be 21 years of age or older. And a parent cannot purchase it in an adult use dispensary and then administer it to their child, because now you're going to have an issue with Department of Children and Family Services. And so children have to be registered and certified in a medical cannabis program. So that's the designation and delegation of that term, medical cannabis, and not adult use, or the more common term is recreational.
And you mentioned earlier that you go to underserved populations, and it sounds like that's kind of where you are with the children, is in this population that needs more advocacy, and you're recognizing a loophole and making your way around it. Why do you have such a drive to serve underserved?
Because they fall through the cracks. And growing up in the South Bronx, I was underserved and underrepresented. And so I'm just giving back to the community that I came from.
And I'm imagining making a huge difference in the process.
I like to believe that.
I mean, you have such a breadth of knowledge, and you are in so many different areas. What lights you up?
When, in fact, I just got a text message from one of my patients because, again, an atypical doctor, some of my special needs, in fact, most of my special needs parents have my personal cell phone number. And so we communicate via text message when they have a challenge or something's happening and they need some support. And after we dealt with the issue that we needed to deal with, the parent was very grateful and expressed that in the final text message, thanking me and expressing their gratitude for me being available and present to help their child. And so those are the things that light me up, being able to walk a parent off the ledge, help them help their child, and make sure that the child is safe, and properly medicated. So that also, hearing individuals that have been taking 10 to 15 medications a day, and I see them for their follow-up visits, and when we're going through the medication list, they're like, well, I don't take that anymore. And no, I'm not on that anymore. No, I'm not using that any longer. And the $64,000 question is, well, why aren't you using these any longer? They're like, oh, well, the use of the cannabis has replaced every one of those to where I don't have to take those medications any longer, which now they have less side effects. They're more active. They're more engaged. They're able to work out, exercise, and now they're losing, 20, 30, 40 pounds because they're in less pain and able to be more active.
So it sounds like you don't just do symptom management, which a lot of doctors have been doing lately for various reasons. Is there a reason that you don't do just the symptom management?
I would have to attribute that to my training in chiropractic. There was a philosophy from a founder of a technique, Dr. Clarence Gonstead, and his mantra was find it, accept it, fix it, leave it alone. And so following that idea, because the belief within chiropractic, having gone to a chiropractic school that was very strong philosophically, it was, above, down, inside out. And so there's a universal intelligence and an innate intelligence. The universal intelligence controls the universe. Innate intelligence controls us. But there's a link and a connection between innate intelligence and universal intelligence. And so we were taught that the power that created the body heals the body. Now, that's true to an extent, but there are circumstances where you need something above and beyond a chiropractic manipulation, spinal adjustment, whatever you want to call it. And why not use something that is natural with the least amount of adverse or side effects to support multiple conditions? I'd rather give somebody one medication to treat 10 different things than 10 different medications to treat just one.
Completely agree with you. And I do love the world of plants. So the more that we can use the wisdom of the plants, I say the better. They interact much better with our systems. Is that a similar philosophy that you use with the mental health side, with the people who have the suicidal ideation and the depression?
Yes. Unfortunately, because the states that I am licensed to practice, we do not have laws or regulations allowing us to use medications or treatment programs that, they're not plants, but they're fungi, from the ground. I don't live or practice in states where I could use mushrooms to manage and treat mental behavioral health challenges. And so in that scenario, the next best thing to be able to create what's called neuroplasticity, create new nerve cells, to create new connections in the brain, to be able to support and address the chronic treatments or chronic conditions that these people are dealing with. That's why I'm utilizing the ketamine. See, it's in a small dose. It's under direct supervision of myself in my office. And so we work very closely with the individual. It is a chemical, but it has been shown to create a different space, a different mindset for the individual. And to date, according to the medical literature, 95% of the people that undergo ketamine-assisted psychotherapy are cured of their conditions. Well, I don't know about you, but there's not much in medicine that is cured with medical treatment. You have to wait 5 years to say that you are in remission from being diagnosed with cancer. Even though you're cancer-free, you're not technically cured until you've lived those 5 years. In medicine, we manage, we treat, but we don't do a whole lot of curing. And so to have something in my toolbox that I can utilize and support individuals that have been on 5, 10, 15 different antidepressant, anti-anxiety, mood stabilizers, antipsychotics, typical and atypical, and have something that comes in and, 3 weeks later, after being treated twice a week for those 3 weeks, utilizing what is called the Yale protocol, and seeing their benchmark numbers for their general anxiety disorder 7 questionnaire, or their physician health questionnaire 9 to measure depression, or their mood disorder questionnaire, and seeing those numbers come down dramatically and significantly, that also is something else that wakes me up and gets me out of bed every morning.
Yeah, I bet. Is there a difference between ketamine-assisted psychotherapy, which is what you said that you do, and just doctors that are using ketamine to assist with mental health? Is there actually a psychotherapy piece involved with what you do?
There is. We have a psychologist that works with our patients, and we work in tandem. And so they come into the office and get the medicine, and they go under session in the office for the ketamine. But then within 24 hours, they have counseling session with one of our counselors for the psychotherapy side of things to address things that came up either in session or following the session. And they help the patient then navigate through what they saw, what they experienced, and then kind of support them in helping them figure out what that means to their individual lives and how they can utilize these lessons to get better and feel better. And that's where a big portion of our success occurs. The studies that have been done, many of them did not include counseling. It was just straight, let's see how the medication works and see if the medication works. I know and saw that the medication works. I want to give the patient every possible tool so that they do not rely on the medication, but utilize their own inherent capabilities to manage and deal with things as they move forward.
Is part of the psychotherapy after you've given the ketamine, is the brain, the neuroplasticity, does that shift their ability to understand things differently through the therapy session? Is that how it's so much more productive?
Excellent question. And the short answer is yes. The long answer is the following. When someone suffers with or deals with chronic post-traumatic stress disorder or chronic depression and has been on the host of medications and the polypharmacology that they've been on, and 5, 10, 15 years of that, and they're still depressed and they're still taking the medications, Albert Einstein has been quoted and credited with saying the definition of insanity is performing the same action expecting a different result. Well, after 5, 10, 15 years of doing the same thing and you're really not any better and you're still having major panic attacks and you're still incapable or unable to leave your home or your room because of the traumas that you relive in your mind 24/7, something has to give. And there's a strong mental component, but also a physical component and cellular component because there's memory throughout our body. We have cellular memory, we have intergenerational traumas that are passed on not only from what we experience in this lifetime, but what our ancestors have experienced, 1, 2, 3, up to 4 generations, which have been shown and proven scientifically. So knowing and understanding that as you are dealing with all these mental health challenges, you are shedding brain cells. And so that's where the short-term memory loss, the mental fog, mental fatigue that many depressed and anxious individuals suffer and deal with on a daily basis, it's very difficult for them to get acclimated and utilize the tools given to them by their counselors because they're not in a place or in a space to be able to do that. Once you use the ketamine and working on the receptors that it does, it stimulates and creates a cascade of events where a neurotransmitter increase, the level of a certain neurotransmitter called glutamate increases. That stimulates an enzyme to express itself called BDNF. And that enzyme allows for the formation of new brain cells. And then by having new brain cells, now you're creating new connections between these brain cells called synapses. And now, the person is going to be more awake, more alert because they've got cells. They're replenishing the cells that have been lost. And so it supports them in their ability and capability to not only comprehend concepts, but implement new concepts that they were unable to do so before because they were not because they were broken, they were lacking the raw materials to be able to do so. And so we need to clean it out and build from the ground up. And the only way to do so is with the neuroplasticity, creating new cells that in essence will then allow them to implement new technology, new techniques, same techniques that they've probably been listening to for the past 5, 10, 15 years, but now they're in a different place, a different space where they are able to move forward better.
It's like someone flipped a switch. Someone
It's like
turned on
doing
the light.
control alt delete of your brain.
Okay.
You're rebooting your brain.
So how long does a brain reboot take? How long is a typical series for somebody who comes in?
So a typical session lasts anywhere between an hour and a half to 2 hours. They come in, they are accompanied by what's called a trip sitter. The most important component is not the medication and it's not the counseling. It's the set and setting, making sure that the individual feels comfortable in the set and setting. And that's why we encourage them to have somebody with them that they feel comfortable with, that can be in the room with them, to give them a sense of peace and calm, because once they receive the medication, they dissociate. They have a hallucinogenic experience or multiple hallucinogenic experiences, visual, auditory. They have all kinds of experiences. They hear different things. They speak to different people, animals, etc. And so being in a space where they feel comfortable and safe and secure is half the battle. Once they're in that state, then it's easier for them to be accepting of the treatment. And then we treat it as if they were going in for a surgical or medical procedure, such as a colonoscopy. We tell them you're not allowed to make any major decisions, no signing of contracts, no driving. So the trip sitter is there to be with them, but also to drive them home and be with them throughout the process to make sure that they are okay, that they continue to be and feel safe. And the usual treatment is twice a week for 3 weeks is our standard protocol.
Are there any side effects with that? Are there any people who have hallucinogenic? Thank you. Who hallucinate and then believe their hallucinations and get stuck or wrapped in that? Is there any problem with the ketamine?
There can be. Since 2020 to present, I've only had one person have what considered a bad trip. But other than that, everyone else has had a very pleasant experience, has had a very peaceful experience. They've come back in a state of just peace and calm and tranquility, and the resolution of issues that in their mind were not resolvable, or making peace with certain scenarios or individuals from their past or their present.
Is ketamine a similar experience to like ayahuasca, to the actual plant medicine?
It to an extent, it works on a different receptor, but it's like we say that there's more than one way to skin a cat. There's more than one way to climb a mountain. As long as you get to the peak, it doesn't matter how you got there. And so whether it's ayahuasca, whether it's psilocybin, magic mushroom, whether it's ketamine, MDMA, the Sonoran toad, all of which I've done and practiced and utilized because I wanted, I'm on the same journey as my patients are. I'm the only difference between them and me is that I sit on one end of a desk and they sit on the opposite end of a desk, and I'm wearing a lab coat. Other than that, I have my share of PTSD. I have my share of mental and emotional traumas. I have my share of intergenerational traumas. And these are things that I've worked through in my lifetime. And because of the benefits I've received from doing the work and doing this type of work, it's allowed me to be able to empathize and be more aware of what my patients have gone through, are going through, or possibly would be going through.
Is there any way of stopping the process? So getting to the process before we have our process, is there any way of someone helping their brain retain neuroplasticity before they lose their neuroplasticity? Is there anything that you know of that can prevent this whole series of events?
Meditation.
It's a very simple word.
Studies have shown that when you meditate, or you're meditating using different frequencies or different sounds, it supports and deals with neuroplasticity. The difference is the length of time. Yogis have been interviewed and have been asked about the use of, whether it's transcendental meditation or tantric, kundalini, etc. types of exercises, and the general consensus has been the same. They all work. It's just a different speed at a different rate of speed. You can meditate for 20, 30, 40 years, or you can receive one of these substances and within 3 weeks be at the same place or close to the same place as if you meditated for 20, 30, 40 years. And so it's kind of like a crutch. Let's say you have an accident, God forbid, and you break your leg. Well, we give you a cast and we give you crutches, and you're in that cast and use those crutches for the length of time that you need that cast on to heal for that bone to heal. The cast doesn't heal the bone. Your body creates the proper things to be able to heal and create and mend that bone. Once the bone is healed and once the callus has formed and the bone is probably stronger than it was originally, we remove the cast and then we start rehabilitation. We rehabilitate physical therapy, occupational therapy, etc. So it's the same concept. The medicine is it augments your ability to be healed. But once you complete the treatment or in conjunction with the treatment, we're utilizing other modalities so that you're not having to rely on the medication forever. You're using skills and techniques and implementing the meditation. One of the things that I encourage patients to do is while they are in session is utilizing some type of sound therapy, whether it's tribal music, something that they have an affinity towards, if they are Native American, African American, Caribbean, from the Caribbean, whatever your ancestry is, utilizing something that links you to your past in the form of sound or one of the frequencies to work on one of the different areas, one of the chakras, or just do a full body cleansing with different frequencies to address and balance your different energy points.
Fully support vibration and frequency as a sound healer. I appreciate you bringing people's awareness to the other modalities that are out there that can support and benefit them. This has been a great conversation, and I want to continue to ask you questions, but I know that we are at our end of time here. So I'm wondering if you have any final thoughts for our listeners.
Well, I always sign off my interviews and podcasts the way I sign my books. And as to date, I've published 15 books, 8 titles in English, 7 titles in Spanish. And when I sign off with the following hashtag: cannabis is medicine. It's time that people stop looking at cannabis as a gateway drug and looking at it as an exit drug, an exit from dependence, an exit from addiction, an exit from everything, and a gateway to your health, a gateway to recovering and restoring your health. And the same concept with the ketamine-assisted psychotherapy. Many people do not want to participate for fear of facing their demons. Well, until and unless they do, they're not going to live the life to the fullest and may not be able to fulfill their passion. So the goal is to educate and empower, because an educated patient is an empowered patient.
And if someone wanted to get in touch with you, how would they do that?
They would go on social media, mainstream media, that all over the place. My website is rosadoadvisory.com. Rosado, like my last name, Rosado, advisory.com. On LinkedIn, YouTube, Instagram, all over Google. I have a YouTube channel called The Dr. Rosado Show. And there are, I would venture to say, a little over 100 podcasts that I've done on YouTube in both English and Spanish.
So people can find you
very, very, very easily.
Great. Thank you so much for the conversation.
It was my honor and pleasure, and I look forward to speaking with you in the future.
That's a wrap for this episode. Honor what landed, release what didn't, and we'll see you next time on The Healing Blueprint.
The views and opinions expressed in this podcast are solely those of the speakers. While we strive to present accurate, up-to-date facts, please note that some statements may include personal opinions and interpretations.